The Model Hospital is a free digital tool for all staff in NHS trusts. It supports you to provide the best patient care in the most efficient way. The idea came from Lord Carter's report into hospital productivity. Trusts can use the Model Hospital to make like-for-like comparisons with their peers and the national average and spot any unjustified or unwarranted variation. We use a weighted activity unit, or WOW, to help trusts compare like with like. You can select your own peers or use our default peer lists to help you find similar trusts. The Model Hospital covers every dimension of a trust's work that might impact on productivity and help improve patient care, including cost, clinical quality, length of stay and staffing. The data comes from many sources, including reference costs, the electronic staff record and annual accounts. So let's see how the Model Hospital works. From the homepage, opportunities help you immediately identify some of your trust's greatest potential efficiency gains. The Browse menu helps you navigate quickly between sections. You can then look at the headline figures for an overall view of your productivity, see how your trust compares on a range of metrics, find out more about how each metric is calculated, and compare specific data points with other trusts using the variation charts. You can search for metrics and bookmark the ones you use the most. You can also get help and support where and when you need it. We're always making improvements to the Model Hospital, including developing dashboards for ambulance, mental health and community trusts. If you have any suggestions or feedback, we'd love to hear from you. To find out more about the Model Hospital and look for opportunities in your trust, visit model.nhs.uk.